Greetings from Indian Journal of Anaesthesia. I am Dr. Khushboo, and today we will be discussing an important insight regarding modern anesthesia practices published in the form of letter to editor in the February issue of Indian Journal of Anaesthesia. The topic of the letter to editor is Time to Rethink Mixing Local Anesthetics, a practical update for modern regional anesthesia. The long-standing practice of mixing short and long-acting local anesthetics has become a topic of renewed scrutiny. Traditionally, it was believed that mixing agents such as lignocaine and bupivacaine offered the benefits of both fast onset and long duration. However, recent evidence suggests that this practice may be less effective in modern clinical settings, particularly with advancements such as ultrasound-guided peripheral nerve blocks. With the widespread use of ultrasound-guided peripheral nerve blocks, the need for hastening block onset by mixing local anesthetics has strikingly diminished. Ultrasound allows for precise localization and distribution of local anesthetics around the nerves, improving the onset times of long-acting agents such as ropivacaine and bupivacaine. Combining short and long-acting agents may no longer offer the clinical advantage it once did. In addition, block duration may somewhat be shortened when mixing local anesthetics, as seen in studies where addition of lignocaine reduced the overall duration of sensory and motor blocks compared to using a long-acting agent alone. Another important implication is that mixing of local anesthetics raises safety concerns. This is because systemic toxicity of two local anesthetics is additive, which increases the risk of adverse events such as cardiovascular or neurotoxic events. Therefore, in context of ultrasound-guided peripheral nerve blocks, where lower doses of local anesthetics can be used effectively, the need to mix local anesthetics becomes even less compelling because the potential risks outweigh the benefits. For example, here we can see the sonoanatomy of quadroiliac plane block. So here we can clearly visualize the muscle plane, that is quadratus lumborum muscle, the bony landmark such as the iliac crest, the direction of the needle insertion like here, as well as the spread of local anesthetics like here. Therefore, even lower doses can effectively provide a good quality of nerve block with the use of ultrasound in this manner. Therefore, as a key point to ponder, the authors suggest that anesthesiologists should prioritize the selection of local anesthetics for ultrasound-guided procedures based on the surgical procedure and patient profile without defaulting to the use of admixtures. Using single long-acting agent in conjunction with ultrasound-guided peripheral nerve block techniques can offer both timely onset as well as prolonged duration of analgesia. Furthermore, avoiding admixtures simplifies dosing calculations and reduces the potential for toxicity. Thank you.